Well, hello and good afternoon, everyone, and welcome. I'm Ken Manson, the chair of the Kawasaki Disease Canada's Research Committee. Thank you for taking the time to join us today. I'm very excited to kick off our fourth session of our new webinar series, The Heart of the Matter. Before we get started, I'd like to share a few housekeeping items. You can see us, but we cannot see you. You can hear us, but we cannot hear you. And if you have any questions throughout this session, you will see at the bottom of the screen, if you hover your mouse, there is a Q&A tab. If you would like to use that to send over any questions for myself or the doctors today, that would be fantastic. And we'll do our best to make sure we get to all of them. So we'd love to hear from you. Please use this tab and we'll do our best to get through them, as I mentioned. So today's session is being recorded and it will be available later on our YouTube channel. We will follow up with a link in the next few days. We're thankful for many healthcare professionals who have supported us and our mission towards enhanced support, education, awareness, and of course, today's focus, research for Kawasaki Disease Canada. Our panelists today each have specific focus for their research, all of which we will hear more about in the next few moments. The information shared today is intended to raise a greater awareness, inclusion for families impacted, and to invoke new concepts to raise greater awareness and expand our reach for enhanced and in some cases new knowledge and understanding about Kawasaki disease. It gives me great pleasure to announce that both our guests today were selected to receive the 2020 Kawasaki Disease Canada Research Award. Congratulations again to both. We here at Kawasaki Disease Canada are so very grateful for the multitude of supporters, your passion and determination to help through the kindness and generosity of our many donors, as well as supporting those who live across Canada and around the world. We wouldn't be able to do this on a regular basis without you. So thank you. The importance of this research cannot be overemphasized. Today, we will hear a little bit more about some of the recent findings and translations from that research. Without further delay, I would like to welcome Drs. Michelle Batthish and Dr. Ray Young. Hello there. Would you mind introducing yourself, Dr. Batthish?
Hi, thank you, Ken. My name is Dr. Michelle Batthish. I'm a pediatric rheumatologist at McMaster Children's Hospital in Hamilton, Ontario. And so thank you again for inviting me to speak today to all of you about some of the research I've been involved with. I'm fairly new to the world of research in Kawasaki disease, and it essentially started a few years ago when I was seeing a patient who was admitted with Kawasaki disease with a student. And after we left the patient's room, the student asked a really important question, and that was, now you know that this child is going to be treated and we know how well they will eventually become after treatment. What are the long-term implications of having this diagnosis? And that's a question we're often faced with by many of the patients and their parents. What does this mean for my child's heart, 5 years from now, 10 years from now? So with that question, we went to the literature to see what has been looked at in the past. And there has been quite a lot looked at, especially in those who have had coronary aneurysms diagnosed during their illness. But we didn't really know much about those who didn't have any aneurysms and were they at increased risk of having any long-term heart effects. So what we decided to do is look through several of our Ontario databases, our hospital databases, our OHIP databases, to see if we can answer that question. So between the years of 1995 and 2018, we're able to look back and identify all kids who were diagnosed with Kawasaki disease in the province of Ontario. And we were able to follow them over up to 24 years and then compare those children to children who were not diagnosed with KD. And we wanted to look at different long-term cardiac outcomes that it included high blood pressure, heart rhythm problems, things that we call our ischemic heart disease or heart attacks, and other heart surgeries. And so we identified over 4,500 children who were diagnosed with KD in the province of Ontario and compared them to kids without KD. And we did find that there was a significant difference between the number of heart effects or heart events in those kids with KD compared to the healthy children. We identified about 16% of those kids having some form of a heart effect. And that could be anywhere, as I said, from high blood pressure to heart surgery. We realized that most of those diagnoses occurred within the first year after their diagnosis of Kawasaki. And fortunately, the risk of death during this follow-up period was actually lower than the kids who didn't have the diagnosis. So this was really interesting information. And we were then able to dig down a little bit deeper and compare those kids who had Kawasaki disease with aneurysms and without. And even those kids without aneurysms also had a slightly increased risk of developing some form of heart event. So with this information, this is still fairly preliminary data. We will definitely try to dig a little deeper and work with our cardiology colleagues and discuss what does this mean to our patients now, and how much more follow-up should these kids have into young adulthood. And do we need to screen for other particular heart conditions as they continue to grow? And then the next phase of our study will look at the health utilization of these kids. And thanks to the grant from KD Canada, we will be able to look and determine, what is the health utilization of these children? Meaning, how often are they coming to see doctors and get admitted to hospitals? How much healthcare are they using? So I look forward to sharing that information once it's ready for you.
Well, that's great. Thank you very much, Michelle. I really enjoyed reading through all of the applications when they came in, and yours in particular. I do have a background in this field, or the medical field, so it was very interesting to read through all the steps and stages and the phases that your trials and studies are going through. So thank you very much for sharing all of that.
Thank you.
So I think we were waiting for one of our other doctors this morning. So we're just waiting to see if she's going to be joining us, hopefully shortly, and I'll have her do an introduction when she arrives. If you don't mind, we did have some questions that were submitted prior to our webinar today. Do you mind if I started to go through a couple of those perhaps with you, Dr.
Sure.
Batthish? Thank you. So let's see. I've got one here, number 5 on our list. I think we shared some here with you. So we often get questions from parents regarding non-cardiac long-term effects of Kawasaki disease. In particular, we often have inquiries regarding the long-term joint pain or arthritis beyond just the subacute phase. So many wonder if having KD causes these long-term joint issues. Is there a correlation between joint issues and KD?
It's a great question, and I've seen that as well. So we know that arthritis or joint inflammation can be part of the initial presentation of KD and can often linger for several weeks after the diagnosis. But we would expect that those joint complaints eventually settle on their own, or sometimes with some anti-inflammatory treatment. So it definitely raises a question, after that time period, what is the correlation between having this diagnosis of Kawasaki disease and long-term joint complaints? So fortunately, while I was doing my study looking at the long-term cardiac effects, I linked up with a group in Ottawa who also wanted to look at some long-term non-cardiac effects of Kawasaki disease. And that group was interested in a list of different autoimmune conditions. So with the same group of, about 4,000 children that we identified in our databases in the province, they wanted to look at, whether or not these children were at increased risk of developing these autoimmune conditions. And that list included arthritis, so either juvenile arthritis or rheumatoid arthritis when you're an adult. The list included type 1 diabetes, celiac disease, inflammatory bowel disease, or multiple sclerosis. And interestingly, they did find that there was a difference. So patients who had a diagnosis of Kawasaki disease were found to have 8 times more likelihood, a chance of developing one of these autoimmune conditions. And even more interestingly, the only autoimmune condition that was significantly different was arthritis. So none of the other conditions were found to be increased in the patients with Kawasaki, but it was only the diagnosis of either juvenile arthritis or rheumatoid arthritis that was found to be increased in that group of patients. So it does raise a question, does that mean that having Kawasaki disease puts you at increased risk of developing arthritis as an older child or an adult? It's not quite clear. The other thing to consider, though, is One of the particular forms of juvenile arthritis, it's called systemic juvenile idiopathic arthritis, presents very differently compared to the other forms of juvenile arthritis. And those kids will often present with fevers, rash, very high inflammation in their blood work, as well as joint pain or joint swelling. So clearly, these kids look a lot like Kawasaki disease patients in that initial presentation. So it raises the question, those kids that were ultimately diagnosed with this form of arthritis, did they really have Kawasaki disease at that first, hospital admission? Or was it truly the first presentation of this form of arthritis? And over time, it just became more clear that that was ultimately the diagnosis. So it's, there's still a lot to learn about whether or not there's a true correlation, or whether or not maybe these kids truly just had the diagnosis of arthritis in the first place and not KD.
Interesting. I have noticed that several of our partners, including yourself, have very specific, I say specialties or subspecialties. So you're a rheumatologist, and another one of our partners is in immunology. So it looks like there's a couple of very specific spaces that can be that you'd be required to be trained in to help identify all of the different possible pieces of what this puzzle can look like.
Yeah, and thanks to our training, we see so much Kawasaki disease that we become quite comfortable and adept at least identifying it, and especially following up on these kids to see, actually, just as I said, before, maybe this wasn't Kawasaki disease in the first place. It was actually this type of arthritis, for example.
It's just a friendly reminder to everyone, there is a Q&A box at the bottom. If you'd like to contribute questions, we'd be more than happy to share them with Dr. Batthish. Just while we're waiting on any other submitted questions, I do have another question here that was shared with us prior to. So number 6 here is much of the research parents read about focuses on finding the cause and improving treatments, which we understand to be of the utmost importance. However, many parents and survivors feel there is not sufficient research being conducted on the possible long-term effects that have yet to be confirmed by research. So further to the previous question, are you aware of any research that is currently being conducted on non-cardiac, rheumatic, long-term complications of KD?
Yes, actually. So what I've been doing, in addition to looking at the long-term cardiac effects, when we sat down with a group of scientists through, it's called ICES, which is the Institute for Clinical Evaluative Sciences. This is the group that works arm's length with the Ministry of Health, collecting all this data through OHIP and billings and hospital admissions. When we first created our group or our cohort of patients with Kawasaki disease that we identified in the province during this time period, so those 4,500 kids or so, of course, our primary research question was to look at the long-term cardiac effects. But we were also able to look at a list of different conditions. So similar to the group that was in Ottawa that wanted to look at a list of autoimmune conditions, we also generated a list of what we called neurodevelopmental outcomes. So we were interested to see those kids who had the diagnosis of KD in that time period, were they at increased risk of other outcomes? And so that list included hearing loss, because we know these patients are all taking aspirin, and we know one of the side effects of aspirin could be hearing issues. So we're just interested to see, did that cause any potential hearing loss issues over time? Other conditions we looked at were anxiety and developmental disorders. So those are either learning disabilities or speech and language issues. And so we also looked at these outcomes in that group of Kawasaki patients. And interestingly, in the hearing loss outcome, we didn't really find a difference between the two groups. So that was actually good news. So, it's good that we don't have any concerns about hearing loss in this group of patients. But what we did find a difference was in the group of developmental disorders, so the learning disabilities or the speech and language issues, albeit small, so only 9% developed these conditions. But compared to the kids who didn't have the diagnosis of Kawasaki, it was found to be significantly higher. And then similarly, in the anxiety disorders outcomes, we also found a slightly increased risk of developing anxiety compared to the kids who didn't have Kawasaki. So it raises a lot of questions. We're not clear as to why we're seeing this change, or it's a signal in the difference between the kids with and without KD. It's hard to know why someone with KD may be at increased risk of, learning disabilities or speech and language disorders. With regards to the anxiety piece, it's also hard. There's a lot of theories. We do know from other studies, though, that like a lot of survey type studies that surveyed parents of children with Kawasaki disease, they did identify that there was a higher perceived anxiety in the families after a diagnosis of Kawasaki. And you can imagine after having a child with, needing to be hospitalized and getting significant medications, potentially heart changes, it can definitely raise a lot of anxiety. But even over the long term, that anxiety persists. And so it's unclear, why that may be. Often families may feel very protective of their child after that diagnosis, and so may be a little bit more protective of them over time, and that's very understandable. And so one theory is that type of overprotectiveness leading to perceived anxiety in the child. These are all sorts of theories that people have suggested in the past. So it's not really sure. It's definitely worth digging in a little bit deeper to truly understand why is it that some of these changes are seen in these families or in these kids.
So not just anxiety to the point of being more vigilant, but actually going a little bit further
Exactly.
on that path.
Yeah, so beyond what you would expect a family to go through after the initial diagnosis. And if you remember, our follow-up period was up to 24 years. So some of these kids are now young adults by the time they're being diagnosed with an anxiety condition.
Right.
So it's not necessarily just within the first year or two after their diagnosis. It could be 5 or 10 years later.
A lot of the pieces you were describing, it would be hard for little ones to communicate that, I'm sure.
Exactly. Yeah. So, 3 or 5-year-old may not be able to express those types of emotions, but as they get older, it may become more clear.
I think my next question was sort of, I guess you touched on it there, is what we just spoke to the pharmacy students recently, and we were really focused on like identifying, those first features where a pharmacist may be able to say, what, this is a little more serious, you should go to Emerge. And we were talking a lot about, under 5 years old. So when you're thinking of long term, how far out are we looking at 10? Is it like when the child's 10 years old? Just correct me if I'm wrong, do you only see them until they're 18? But obviously you can look at data further than that.
Yeah. So the data that we collected, so the years, if we think back, so we looked from 1995 to 2018, because that was just the last year where we had the most current up-to-date information from last year, a year ago. So if you think, if it was a 5-year-old who was diagnosed in 1995, they may be in their 20s at their last, potential visit in 2018. But if someone was diagnosed in 2015, they may only be 3 years of follow-up. So the length of follow-up is obviously different in our group. So we kind of clustered the patients, within first 5 years of follow-up, first 10 years, or even more, just to see if there was a difference. And so at least with the anxiety piece, we did see that that increased risk was present at all those time periods. So whether it was just a few years after follow-up or up to 10 years after follow-up.
Thanks.
And so I think what will be really helpful to do, maybe in 5 or 10 years, is to maybe redo the analysis and have even a much longer follow-up period of time, so that, instead of 24 years of follow-up, it could be 30, 40 years. So now we're moving, well into adulthood to see, what are some of these effects look like, not just, into late teens, early 20s, but when they're maybe a little bit older.
Looking forward to seeing that.
Yeah.
So I don't see any questions necessarily from our audience here, so I will go to another one that was submitted beforehand. So during our education webinar recently, we asked Doctors McCrindle and Dada, a couple of other specialist partners that we work with, about recurrences of KD. So they mentioned that often what first appears in the second occurrence often ends up leading to a different diagnosis. So can you provide some more insight into this based on what you've experienced?
Yeah, absolutely. So we do know that recurrences can occur, and that's usually within that early period of time since their diagnosis. But if a child is coming back, 6 months, 1 year later with what looks like a recurrence of KD, we definitely have to think, is this still Kawasaki disease that we're dealing with, or another diagnosis? And as I said, previously, there is at least one form of arthritis that can definitely look a lot like Kawasaki. In fact, I have a few patients who have this form of arthritis, the systemic form of arthritis, who on initial presentation to hospital were diagnosed with Kawasaki disease because they were young, they came in with 4 or 5 days of fever, they had rash and joint pain and lots of inflammation in their blood. And so they were treated like Kawasaki disease with IVIG and aspirin, and their echocardiograms were fortunately clear or normal, but they didn't respond, or they kept coming back with fevers, within that initial few weeks of presentation. And then over that period of time, it became clear that this wasn't KD at all, because now they had, very many swollen joints or an enlarged liver or spleen or other changes in blood work that made us think, oh, that this is probably not KD and likely this other type of arthritis. So that's definitely something that we've seen. And so I think we're all very familiar and comfortable with making that kind of distinction now. The other thing to consider is other conditions that may also look like Kawasaki disease. We know there's a whole list of infections that can mimic KD. And so again, depending on the timing and how they come back and their recurrence, is this a recurrence? Is this another diagnosis? Is this an infection that we're just dealing with at this time? Or was the first time an infection and now we're dealing with Kawasaki disease? So there's a lot of different permutations of conditions we can think of that may make us think that this is not really a recurrence of their KD and just something else.
Okay. Our next question. So continuing on this theme of correlation, is there a correlation of Kawasaki disease with illnesses such as systemic juvenile arthritis or any of the periodic fever syndromes such as TRAPS, or PFAPA? You'll know what those are. I am not sure. Sorry.
Okay, yeah.
There's always acronyms. We have heard of a few cases where children who previously had KD are later diagnosed with these illnesses. Is this a common occurrence that you see in your practice?
Yeah, so, just like my other example, I have had a couple of kids who were initially diagnosed with Kawasaki disease and then ultimately had this systemic form of juvenile arthritis. I've not had any of the other conditions, but I could see how it could happen. So those acronyms you alluded to are a group of fever syndromes. So these are a group of conditions where patients will present with kind of regularly occurring episodes of fever with a list of different symptoms. And some of them can be rashes and include other changes as well. So, joint pain, tummy pain, chest pain, and then other changes in blood work too. So again, just like in the systemic JI, I could easily imagine a case where you have a patient admitted with fever, rash, joint pain, and it's thought to be Kawasaki and they're treated with Kawasaki. And then several months later, they come back with exactly the same set of symptoms. And then a couple of months later, again, exactly the same symptoms. So that definitely will raise an alarm in our minds to think, could this truly be Kawasaki versus what we call these periodic fever syndromes? And so, we're able to test for some of these with some special genetic testing. And we'll be able to determine if that's the case. And if that is the case, then there's definitely a lot of good treatments available for those patients.
Thank you. It looks like we've got a question now from Karen. If you'd like to go ahead, Karen.
Hi, Dr. Batthish.
Hi,
as you know, I am the head of our support committee at Kawasaki Disease Canada. And so a lot of those questions were common ones that we've gotten. But so further to that, because I think you gave really great explanations of how it can be investigated, but what would your advice be to parents? Because I get a lot of parents that said, well, my child had KD, but so similar, the fever keeps coming back, or they still have joint pain. I've taken them to my family doctor and they're like, oh, it could just be a long recovery from KD. Don't worry about it. Or that don't want to send them to rheumatologist. So a lot of them feel at a loss. They're worried that either the KD inflammation is still there and that something's going to happen, they're going to get aneurysms, or they're worried that something else is going on, but they're not always being taken seriously because a lot of the parents, we said, are still anxious. So I think a lot of doctors, unfortunately, feel that that they are blowing out of proportion or that everything is because of KD. So in these cases where there's some ongoing either signs of inflammation or fever that comes once in a while, what would your advice be? How can they get the help to make sure that it's not something else going on?
I can completely understand how a family may be experiencing that kind of anxiety after a diagnosis like Kawasaki disease, because of course the kids can look quite unwell and be unwell during that initial acute phase or that hospitalization. And then once they go home for several days or weeks, they may still have some potential symptoms that may be ongoing, like the joint pains or maybe a rash that's kind of fading in and out. So, I think the first thing is to trust your gut. If you are not happy with the way your child looks, keep fighting for them and advocate for them. And if it is within those first few weeks, and if it is symptoms like joint pain, then it could be just that kind of remnant of the first Kawasaki disease episode. But of course, if we're talking months now of either the same symptom like joint pain or joint swelling, or a period of time where you have clear, distinct episodes where they look unwell with either fever or rash or something else, and then they're well, and then again it happens, and then they're well, and just that pattern continues. That could be a clue that maybe something is going on. And it could be, outside of Kawasaki disease, as we talked about, there's a list of other conditions. It could be infections too. So we have to keep a broad, open mind as to what else could be going on. And if a family doctor is reluctant to send referrals straight to a pediatric rheumatologist, because often, family doctors are like the gatekeepers of these types of referrals. So they want to be judicious maybe in who they and how they refer and how many. I mean, a really good first step could be getting a referral to a pediatrician, because a pediatrician is more than qualified at also looking at this in a broad lens and identifying, could this be an infection? Could this be any other list of conditions? Or does it truly have the flavor of some autoimmune or rheumatologic condition? And if that's the case, then they will send the referral to rheumatology, in which case we'll definitely see them as well. So, keep fighting. And if, maybe if rheumatology isn't the first step, maybe a pediatrician would be a great first step for your concerns to be addressed. Worst case scenario, you get reassurance from the pediatrician. And if not, then other investigations may get done. And then ultimately a referral to rheumatology can be arranged as well.
Okay, that's great. Thank you. That's really helpful. But to touch on something else that you mentioned, which I don't think, that I've read, there's been a stated time period, but when kids are recovering from KD, is it normal to have things like the rash come back a little bit and go away? Or I know they always talk about still having fever a little bit even after the IVIG can be seen, but are there typical things that are not, I guess, normal? I don't like to use the word normal, because in KD, I think things are there's a whole range of what is normal, but what might be accepted and what is not necessarily cause for concern within the subacute phase. So like after discharge from the hospital, let's say the first 2 to 3 weeks, what are symptoms that we consider nothing to be alarmed about, that they don't need to return to the hospital necessarily?
So I would say joint pain is probably one of the more common ones that can last for a few weeks after that initial acute phase. And, rashes, maybe not so much, but of course we all know that some of the kids get that typical peeling of the skin. So those kind of skin changes, of course, we may anticipate. So those wouldn't be as much of cause for concern. Of course, fevers, high persistent fevers would be a concern and would, warrant a re-checkup with your family doctor, or depending on how concerned you are, back to the emergency department as well. So I would probably stick with, just to be safe and conservative, the joint pains can naggle for a little bit, and some skin changes, but related to the peeling that we tend to see in the fingers and toes.
Okay. Thank you. Sorry to go to non-research specific questions, but I have you as a rheumatologist, as an expert with us. So I was like, I got to take advantage of that, because these are some of the most common questions we get on a day-to-day basis. So thank you so much.
Well, good questions. Thanks a lot, Karen. So I just received news that our other specialist that was joining us today, Dr. Young, did have a family emergency and does apologize to the group for being unable to join us today. Now, I know we were going to potentially speak to her about a couple of topics, and maybe if I can ask you, Dr. Batthish, just touching on something called MIS-C. So this multi-centered or it's multi-system inflammatory syndrome that sort of surfaced around the time of COVID-19 and some other questions that are surfacing and showing up around that. Do you mind sharing what you've seen in your experience so far,
Sure.
I guess, in that space?
Yeah. So, back in the spring last year, I think was the first time people around the world were identifying this type of inflammatory condition that looked a lot like Kawasaki disease, but seemed to be related to either an active COVID infection or shortly after being exposed to COVID or having had COVID. And it seemed to only occur in children. And so I remember, I clearly remember there was, I was watching CNN, and they were even talking about Kawasaki disease, and it kind of threw me off as to, why is CNN even talking about Kawasaki disease? And then my mom, of course, texts me, and she's like, is that something that you look after? And so for the first time, my mom was even aware of Kawasaki disease. And so clearly, definitely raised concern, because this inflammatory response to COVID definitely looks like Kawasaki. And there's still debate as to, is it in the spectrum of KD, meaning, is it just like a more aggressive form of Kawasaki disease, or is it truly a separate condition that just seems to look like it? We've been able to at least now identify some key differences between true classic Kawasaki disease and this new condition, MIS-C. And so far, what we've been able to tell is that most of the kids with MIS-C tend to be older, so they're over 5. If anything, they're maybe 8 and above. And they tend to have some of the abdominal symptoms that we don't typically see in Kawasaki disease. So these kids often will come with a history of having had either vomiting or diarrhea, and that's not a classic symptom that we see in Kawasaki. We know that kids with KD can definitely have some abdominal pain, especially if their gallbladder is inflamed. That's definitely one of those features we do know. But in these kids, these older kids, they tend to have vomiting and diarrhea. And then for unfortunate reasons, they also have more aggressive heart effects. So these kids' heart function seems to be affected a lot more than kids with Kawasaki. Both can still get aneurysms, but these kids tend to have difficulty with their heart pumping blood across their body. And so they may have low blood pressure when they come and are seen in the hospital, and often may need ICU support a lot more frequently than we do see in kids with Kawasaki. Most of the times, fortunately, our kids with KD are not in the ICU. It is a rare occurrence, but in these kids, it definitely can occur a lot more frequently. And then there's some more subtle changes that we'll see in blood work that definitely is different between those two groups of conditions. The good news is that the initial treatment is the same. So even if we're not 100% clear, if we're dealing with classic Kawasaki disease, incomplete Kawasaki disease, or this new condition, MIS-C, so far research supports the use for IVIG, aspirin, as well as steroids. And so we tend to use steroids a lot more often in these kids. Of course, we can use steroids in kids with Kawasaki disease, but it's not usually our first option. We'll wait to see how they respond to IVIG. But in the MIS-C group, we definitely seen to go to steroids a lot faster. So, we've definitely seen this across the country. So I know, early last summer, spring, Montreal was hit quite hard, given their COVID numbers, of course. And then over the fall, winter, I know Sick Kids had quite a number of kids and continue to see them. And then here in Hamilton, we kept waiting. So we prepared ourselves over the summer and the fall, meeting with all the different specialties that would be involved. And then we finally were hit just, about a month ago. And so I think that relates to the second wave that we were all experiencing just around the December, the holiday break. And so with the numbers going up, and it makes sense because it is usually a few weeks after a COVID exposure that we then see these kids. And then when we check for their antibody levels for the COVID infection, most of them come back positive. Or we get the story from the family that, oh yes, there was an exposure at the daycare, or yeah, oh, I had a flu-like illness. I didn't get tested, but clearly I had fever and a flu-like illness, so probably was COVID. No one else in the family got symptomatic. And most of these kids don't have symptoms from the active COVID infection. It's only several weeks later do they then present with these prolonged fevers, the vomiting, the diarrhea. They can get rashes. They can also get the red eyes, just like the kids with KD as well. So it's really fascinating. You walk into the room and you're like, I'm looking at someone who has KD, but they're much bigger and they're much sicker, unfortunately, and they've had this COVID exposure. So it's a lot of learning. It's too bad Dr. Young isn't here, because I know she's doing some fascinating work right now, looking at, the biology behind all of this, and whether or not there's some predictive factors for why some kids get it and some don't, at the cellular level and so on. So I'm sure she'd be able to share some of that later with us.
Well, thank you. I do remember a conversation with Dr. Young about her eagerness to look at the fact that there are so many particular cases in such a small period of time, to be able to collect some samples from the family and the children, and to be able to look into, almost in real time, what's causing this to happen, right. Just like it is now. So hopefully we'll catch her on a future episode. If you don't mind, just staying with the pandemic theme, we'll just talk about research for a moment. Have you found that your research in particular has been adversely affected, or anything in this particular sphere regarding the pausing or the delays that have resulted from the pandemic? That could be everything from, getting the data you need is delayed because there's not enough workers allowed in an office, to the test tube manufacturers on back order because of or on a slow production line because of their restrictions. So right. Is that impacted you at all?
So, about a year ago, it's been almost a year now since this all started. And, initially everything just came to a halt, right? Everyone was just in lockdown. We were scrambling in the hospitals just to figure out, how do we continue caring for our patients virtually? So we're just kind of figuring out, how do we see patients even in follow-up appointments via platforms like Zoom and telephone, and everyone was just trying to figure out, those basic things first. So of course, research, it took a pause for us. And then over the summer, as we became more comfortable with, the virtual care that we were providing, and then we became, more knowledgeable about the pandemic and what kind of, PPE we all needed to be. There were definitely a little bit more loosening of restrictions within the hospital and the university for things like research. Fortunately, for the research that I've been doing on Kawasaki disease, because it's all based on database information, even those scientists working at ICES who are gathering all that data from, they were all working from home because they can get everything they need through, their platforms online. Once we were able to just kind of get back into the research mode, we were able to just continue full steam ahead with that information and that data collection and analysis and writing it up and all that fun stuff afterwards, because all of that could be done from home. Unfortunately, other research, though, had to be either continues to be paused or is just slower, because of course, a lot of research depends on seeing the patients. And if they're not coming to a hospital as often because they're doing virtual care, we may not be able to collect some of that data. So there's been also some pivoting with, okay, well, if I'm not going to be able to see them and give them this questionnaire, well, let's email them the questionnaire and get it that way, right? Let's join the 21st century and just start using online platforms for some of that data collection. So of course, all of that is now working for different research groups. But the last piece, as you kind of alluded to, is this biosample collection, as people would refer to. So if I had to collect, not that I do this, but of course I know Dr. Young does, collecting, either saliva samples or blood tests samples from these patients, that may have been slowed down early on, but I'm sure now there are ways of still arranging to see those patients and getting whatever samples that need to be done. The other thing I think that COVID did is, because it kind of forced us to do these kind of online virtual platform meetings, it definitely has helped in some ways, because what was once, okay, we need to pick a time and a day to meet with certain people from across the country, get your flights, get your hotels and so on, can be arranged in a Zoom meeting in no time, right? As long as you pick a time that works for everyone. So it's been really nice that we're still able to connect virtually and work with groups across the country using these online platforms. So it's really forced us to use this a lot more and become more comfortable with it. And so hopefully, and I definitely can see how this will continue moving forward, even after COVID is a long memory and we're able to fly again, but we'll definitely continue to use these platforms to work together.
It does seem to be one, I think, beneficial side effect of this is it really pushed us onto these platforms. Because before it was kind of like, I don't want to use Adobe Connect. I'll see them next week, or I can use FaceTime if everyone's together. Or there was some of the more common ones that perhaps we were either comfortable with or we steered away from because they were too cumbersome. Adobe Connect's quite cumbersome to use, but now with Teams and Zoom, at the very least, I'm sure it's great to be able to connect with colleagues from across the country a lot easier, especially with its integration into Outlook and your calendar and all these other things, right? So
it's definitely helped. And I think the other thing is going back to like virtual appointments with patients and their families. I think it's been really beneficial in both ways for both the patients and families, because I can imagine many may have to, commute an hour or more sometimes to get to a doctor's appointment, take half a day off work, miss, a day of school. While now, I'm getting quick follow-up phone calls and I'm speaking to a teenager in the hallway of their school because, they're just excusing themselves from class for 10 minutes, calling me, doing a quick checkup, and then they're back to school and the parents didn't have to take time off work and everyone is, happy with that arrangement. So in some cases it's worked out really well. And I definitely think that it'll continue to work after COVID is over too.
Great, that's good to hear. I'm just going to open up the floor again and see if there's any other questions from our audience. Give folks a moment to think or raise their hands. Well, seeing none, we've got a little bit of time left, but I think if there's no further questions from my side of things and our audience hasn't shared anything in the last few minutes and certainly can jump in at any time, I'm going to sort of lead toward our closing here and saying thank you to you, Dr. Batthish. So a huge thank you for addressing the questions and the concerns that were shared today, as well as all of the tangents that these conversations sort of take us on. I think it's really nice to hear all of the different contributions and opinions and whatnot that's going on around us and around this subject. So thank you very much. Your research is extremely critical to Kawasaki disease, and your contributions to the Kawasaki Disease Canada Advisory Board is also greatly appreciated. Our collective quest is simple. We are looking to increase the number of early diagnosis by broadening awareness and education of Kawasaki disease symptoms and treatments, thereby decreasing the incidence of long-term complications, and many of which you touched on today. Your passion and dedication and the work that you do is it's invaluable in helping the families and patients prevail over this potentially life-threatening disease. We just can't say enough about how much we appreciate it, and certainly the families of those affected.
Thank you again for inviting me.
Oh, you're very welcome. We also wanted to thank our audience today. This is our 4th session, and it does conclude our webinar series. This is the heart of the matter, and there will certainly be more to come. We really enjoyed engaging the community on both sides, the patients and families and our specialists and partners that we work with on a regular basis. It's truly been a pleasure. There's much more work to do to mitigate any misdiagnoses or continue to build greater awareness and expand education and research in this area. For general housekeeping for everybody, the previously recorded sessions are all available on our YouTube channel, and today's session will be posted very soon. So far, we've heard parents who shared their journeys with children having had Kawasaki disease. We want you all to know you are not alone. We've heard from our medical professionals, renowned pediatric cardiologists who shared experiences and discoveries. And we heard from our global partners in Italy and UK, where we share a common enemy, Kawasaki disease, which literally knows no boundaries, we've noticed geographically, ethnicity-wise or otherwise. So we sincerely hope today's session, it rounds out a clear picture for you. And most importantly, we ask that you share your knowledge you've gained and tell at least one person who has children in their life about the real threat of Kawasaki disease. When our charity was first founded over 6 years ago, our vow was to increase awareness of the disease, provide support for parents, patients, families that have been impacted, and support them and fund the best research we can get within our reach. And certainly we're proud of all of those accomplishments. Where there was once oblivion to Kawasaki disease, now parents have awareness and knowledge. What was once despair and fear, now medical professionals are more educated and continue to educate us with the changes that are occurring. And the families that are impacted, who have once felt so hopeless, now find encouragement in the warmth and comforting parent who has experienced the same anguish. Together, we build KD communities around the world and in turn provide a huge service by sharing their voice to inform the globe about Kawasaki disease. We appreciate all of our supporters and we are deeply grateful for their loyalty, their compassion, their time, and their belief in what we do. We cannot do it alone. Awareness truly can save lives. Please learn the symptoms and tell others. Thank you for joining us today and have a wonderful day and stay safe. Thank you.